enlightened and educated on glaucoma. Now, last week, the conversation on glaucoma, we had Nehemiah Hammond, who is an ophthalmology resident at Kolebu Teaching Hospital, and he gave us quite a number of revelations in relation to glaucoma, saying that glaucoma is also known as the thief of sight, the silent thief of sight. And so unknowing to you, especially if you are fond of not having regular checkups, going to hospital to have your regular checkups and all that, before you realize, you've gone blind without you knowing, without you noticing and all that. And so they call it the silent thief of sight. And I asked him if there was anything at all in relation to doctors now confirming or affirming the main cause of glaucoma. But he did mention that unfortunately not yet. Research is still being done as to what really causes glaucoma, but there are risk factors, and so he laid down the risk factors. We have elevated eye pressure, age. He specifically stated that when you hit the age of 40, he would advise that you go get your eye checked regularly. And he also mentioned race and then family history. If you know that you have a family member, anybody close to you that has glaucoma or has had glaucoma, please and please, the probability or propensity of you having glaucoma is quite high. And so you need to pay attention to your sight and get tested. And then also he did mention the last one, which is short-sightedness. So these were the risk factors that he did mention last week. And also I was quite alarmed and I was wondering if glaucoma was only amongst adults. Is there any age range? But he did mention that no, it's not only adults. There's something called congenital glaucoma, and that is glaucoma in babies. And so babies can have glaucoma. I told you, this conversation is perfect for you. And glaucoma being, the thief of sight, the silent thief of sight, without you noticing, you have, your eye is itching you, your eyes are hurting a little bit, and you think that, it's random, it will go away. It could be something that you do not know. So please and please, like Dr. Nehemiah Hammond said last week, if you're 40 and above, and you've never had your eye checked, make sure that you get your eye checked. Like I said today, we are going to tackle every single question that came in last week because we couldn't. And so I have seated with me this morning. His first name is very interesting to me. I like his first name a lot, and that is Dr. N.Omaboe. He is an optometrist with Ines Eye Vision Care Center. Good morning, Doc.
Good morning.
How are you?
I'm doing well. How are you too?
I'm doing awesome. So, Doc, in relation to the recap that I gave on the conversation of glaucoma, is there anything that you would want to add?
Yes, as you just rightly said, the glaucoma is a silent thief of sight. Mm-hmm. It comes unawares.
Yes.
Most of the time, there will be no symptoms, there will be no signs, and gradually, no pain, nothing.
Yeah.
And especially the kind of culture that we have, if you are not feeling any pain in a part of your body, you don't visit your doctor. Till you are going through pain and things before you visit your doctor. But one of the most dangerous eye disease that affect us, that deprive us of our economy, is glaucoma. And it will not come with any pain, nothing. And gradually, your sight goes, and it's irreversible. That's the most sad aspect of glaucoma.
Yeah. And I remember that Nehemiah did mention something like outside in, meaning that it starts, so he did say that, so you see that your peripheral, you usually you can see from the corner of your eye. But then this time around, you're unable to see, and it comes in gradually, and then before you realize it's total blindness.
Yeah.
And so I feel like, please, ladies and gentlemen, we need to pay attention to these. Because just like Dr. N.Omaboe has said, unknowing to you, before you realize you've gone blind, and it's irreversible. So there's no cure to glaucoma.
Yeah. It can only be managed.
Managed, okay.
I just want to give a bit of illustration about from the outside to in.
Right.
Assuming you are looking straight ahead of you like this, you're supposed to see without turning the eye or the head a certain angle when you raise your head. Hit this way, temporarily upwards and down, a certain radius. You're supposed to be able to see without turning the head or the eye. But what glaucoma does is that it destroys that field of vision gradually. And naturally, if I can't see this side of my vision, I'll just turn my head or and you'll see. So it will not occur to you. And as I said the last time, we have two eyes. So one eye is totally gone and they are not even aware. So you just turn the head and you can see everything. So once in a while, just close one eye, see how far you can see at your peripheral, or look straight and just wiggle your hands like this, whether you could be able to pick without turning your head.
Right.
So those are some of the few tricks that you can occasionally examine yourself, even at home, and you'll be able to pick up some of these things gradually.
Okay, so I did mention congenital glaucoma.
Yeah.
I want us to tackle a little deeper into that, because you would wonder what would make a baby or a child get glaucoma. What could it possibly be? Is it that they could sometimes be born with it? What are some of the things that goes on? Maybe the mother passing on something. I don't know exactly. So kindly explain that.
Yeah. As I said last week, some of the risk factors are the family history.
Yes.
You pick somebody in the family has glaucoma. The probability of other people in the family also having the disease is very, very high.
Yeah.
So normally when we see glaucoma in the family, we want to make sure that parents, siblings, everybody check. If we check and there's nothing, we still want to be monitoring. So these are some of the things. Assume maybe the mother has glaucoma, is not even aware. He gave birth and glaucoma is seen in the child. So those things, when it's seen early, the catchword is when it's seen early, they can be helped.
Okay, so is there a probability of a child, right the moment that the child is born, the child has glaucoma, or it has to take a little while before it develops?
No, he's born with it.
Okay.
Yeah.
What is the youngest age that, has been recorded?
Yeah, just born with it. So the very day you came out of your...
day.
Yeah, you come from your mom.
You could be...
Is there.
So with that, nothing can be done about it?
No, so it doesn't mean that when you are just born with glaucoma, you go blind that first day, no.
Okay.
So the disease is there.
Right.
So when it's seen, then the necessary interventions will be done to help that child.
Okay, so the necessary interventions with the child. Can you please run us through exactly what can be done?
So, as I said, the only variable that we can have control over is the intraocular pressure. So at times medication is given to lower the intraocular pressure so that it will not destroy the optic nerve head.
Right.
That will invariably cause vision to be lost totally.
Right.
But most of the time for children, a surgical procedure is done to open the angle so that the liquid can easily flow so that the pressure buildup will reduce. The main challenge is the pressure. I always try to give this scenario to our patients that you have a polytank. In almost every household, there's a polytank. The rate of inflow and the rate of outflow must be the same. But if the rate of inflow is higher compared to the rate of outflow, there will be a pressure build up in the tank.
Yeah.
And that's what happens during glaucoma.
Right.
The eye keeps on producing the fluid. It's hard to drain off.
Yeah.
So if the rate of production is higher than the rate of outflow, it will create a pressure build up in the eye. And the pressure will destroy the nerve that carry information to the brain for us to see. And this scenario always gives, like when you're in the house, you have a circuit where all your fuses are there. If you want lights in your room, if any of the circuit goes off at the circuit board, you won't get lights in your room. So the nerves are like the wires that carry information to the bulb to light up. So if the nerves are destroyed, you switch on your light, nothing will come. So the pressure, the intraocular pressure tends to destroy the nerves that carry information to the brain.
Okay.
So far as the pressure is on the normal level, is taken care of, we are safe.
Wow. So you would find, so when that happens, especially with babies, immediately they start wearing glasses, or what then happens? Because I see quite a number of videos that you see babies, they can't see, and then for the very first time, they put on certain glasses, and then it's like they can see colors. I don't know how.
Oh, glaucoma had nothing to do with glasses. They are two different things.
Okay.
Children can be born with very high refractive errors where he can't see far, refracting is done.
Right.
He put on glasses, now he can see clearly.
Yes. Okay.
Yeah, it's
Okay.
totally different.
Okay.
Glaucoma is a disease that destroys the optic nerve head.
Yeah.
So they are totally different things altogether.
So right after the child is operated on, how then does the child, what is the outlook? How does it look like?
Oh, so now the child is operated on, the pressure is now kept at bay. You still have to be monitoring to see how, because the child is still developing, it's still growing.
Right.
So all these things have to be, you have to be monitoring so that you don't have any spikes in the pressure. Because the little spikes or increase in pressure will invariably go and destroy the optic nerve, and everything will just come to cause 90.
Wow. We are still talking about glaucoma. The entire month of January is Glaucoma Awareness. I have seated with me Dr. N.Omaboe, and he is here to answer all your questions in relation to glaucoma. Like I said earlier, last week we couldn't answer all your questions, and so we are taking the questions that we received from last week. And so Doc is going to handle them one after the other. So I'm going to go to our screen, and then we'll start reading them. Okay, so let's start with this one. All right, so I'll take a couple, and then Doc, whichever one that you would want to address, we do so. My name is John. Please, does natural honey help in reducing eye pressure? Okay, Doc, would you want to address that, or I should move on?
No, you just move on.
Okay. Good morning. A doctor once told me the back of my eye is almost capped. Please explain this to me, Mary. I use Cusimolol eye drop. Okay. Next one. Hi, Doc. I have a brother. He's about 20 years old. He's having eye problem. He said he sees smoke around objects sometimes, so I'm asking if it's glaucoma. Doc, should I move on?
Let's move on.
How can I prevent my right eye from getting glaucoma? I was told my left eye is already affected.
So let's start from the honey.
Okay.
There is no empirical evidence that honey can treat glaucoma.
Okay.
But as much as possible, the eye is part of the body, and we expect that for you to have a very healthy life, you have to have a very good lifestyle in terms of your eating habits, exercise. All those things tend to also have effect on the eye.
Okay.
But honey in particular, there's nothing that shows that honey can cure glaucoma.
Okay. Would you address the Cusimolol eye drop?
Cusimolol, yeah. It's one of the eye drops that we use in reducing the pressure in the eye.
Okay. All right, and the next one, we had this gentleman saying that his brother is 20 years old and have an eye problem. He says that he sees smoke around objects. And so he's asking if, I think for that he should just go and get his eye checked, I believe.
Yes, it's better you check it. One person was talking about that one eye is already
that was
comatose, and then the other eye. Occasionally you can have one eye that has glaucoma, the other eye nothing. Okay. But most of the time it counts on both eyes. Okay. And what we want to encourage is that follow up on your appointment dates. It's one thing that is so difficult for patients, and because you are being managed, there's no cure for glaucoma. You are given drugs, you are told what to do, when to come for your checkups, and you must not miss those periods, because for some, they go to the hospital, is given one drug, and for the next 10 years,
and that's
it's
it.
just on the drugs.
Right.
But you have to be going on your appointment days for the pressure to be checked, for the visual fields to be checked. At times, if a scan is done, whether the drug is helping you, whether there's a need for us to change,
right.
add, or those kind of things.
Okay, all right. Let's move on with the questions. Good morning, Asieduwaa. Please help me ask the doctor if even surgery cannot reverse glaucoma. Unfortunately, it is irreversible. Doc, I believe I've answered correctly.
It's irreversible.
It's irreversible. Next one. Good morning. My dad of over 70 years has been living with glaucoma for some years now, which has resulted in him going partially blind. A friend recommended a product called Miracell. Apparently, it works directly on the cells. My question is, can a product like this work wonders with a condition which is irreversible?
This is the first time I hear about Miracell.
Okay, okay. Okay. All right. Let's move on. So I think that he has to visit the eye center.
He still has to visit.
Yes.
The challenge is that at times it gets so frustrating for the patients, because the idea of people going to the hospital, I have a headache, I go to the hospital, I've given drug, I expect the headaches to go.
Right.
But here is the case that you have to be on your medication almost for the rest of your life.
Yeah.
And it's not improving. Glaucoma, the management is not intended to improve upon your vision, but to slow down the rate of deterioration.
Okay.
And you explain to people, and it's so difficult. And at times, too, the main challenge at times is very economical, because some of the drugs are very, very expensive. And it's very, very small in a bottle. Within a month, it's done.
Yeah.
And you have to refill again. So at times people get so frustrated and they go off their drugs. So by the time they come back, the eyes are totally gone.
Wow. Next question. Hi, Asieduwaa. Good morning. Please ask the doctor, can a pregnant woman with newly diagnosed of glaucoma take ciprofloxacin, ophthalmic solution, and cool eyes medication?
It's better she sees a gynae when it comes to some of these things, so that we can work together.
All right. Next one. I have been living with the disease since 1993, and a surgery was done in 1997. Unfortunately, I had lost one eye since 1995, but thank God I have been able to school and now teaching in one of the SHS in the country. What has really helped me is regular checkups. Please continue to educate the public on this issue. Good work, Dan. Thank you so much. I wish you added your name so we could properly acknowledge you, but thank you for this one. Next one, I used to have problems with my eyes. I took it for a checkup. Then I was informed it's a glaucoma, and sometimes the side of my eye will be dark, then it will give me headaches and vomiting. But doctor, my question is, how will it go? And the same person again says, I used to go to hospital, but anytime I got to the hospital, the medicine I brought home, I don't get, unless I go out and search for it, but I don't use it to get what it has been prescribed for me. So this made me stop going for checkup. Aish, this is quite alarming. This is quite alarming. So, should I move on, Doc?
Yeah, move on there.
Okay. Let's take next one. Good morning, Dr. Hammond. Please, can you have glaucoma and the corneas will not be darkening? Because I was diagnosed of glaucoma, but I've not been experiencing the darkening of the corner of the eyes. I also want to ask whether the environment or your location can also affect the eyes.
It's very difficult to say. It's not everybody that will see darkness around the corner of their eyes.
Okay.
Normally, when we do other tests, because most of the time you don't even notice it, we do what we call the visual fields. You are put in a machine and light projections are done. So when everything is done, a printout will be able to tell us which part of your retina has been compromised.
Okay.
So you don't go around looking for dark spots around your vision.
Yeah.
Most of the time, it's when it's well advanced that you notice most of these things.
Oh.
But when it's there, you may not even notice anything.
Notice it, yeah. So just regularly get checked. Okay, next one. Can babies get cataracts from birth? As the doctor said for glaucoma, my newborn baby had something on the eyes which keeps growing as she ages. We took her to Kolebu and they ran tests and said it's cataract. But there was no recommendations as to what to do next. She's almost 2 years now and it keeps growing.
Yeah, babies can be born with cataracts in the eye. So since he's been going, she just follow up his visits. At the appropriate time, they will let her know what to do.
Okay, follow up your visits then. Oh, let's see. Aish. What do we have here? Okay, so I think we'll have to move on because this one, she's talking about Guinness World Records. Do we have some more? Okay. No, let's see what this one is. So we'll try and then we'll try and see if we can get some messages from today. But viewers, please continue sending in your messages for this morning. Yes, send in your messages for this morning and then Doc will answer the questions for you. Let me kindly take a seat. Okay, now Doc, question. How long can one live with glaucoma?
It depends on how serious we are with the treatment. And then I keep on saying that glaucoma, you co-manage it with your doctor.
Okay.
If your doctor gives you all the necessary advice, prescriptions and everything, and you don't cooperate with your doctor, we can't do much about it. So you need to work together with your doctor. Take your medications when you are supposed to take. Go for your reviews. Do the necessary tests that they want you to do. And for most people, they can live for almost all their lives and everything will be fine.
But you'll be taking medications for the rest of your life.
That's it. It's just eye drops.
Oh, it's just eye drops?
Just eye drops. It's only on few occasions where you talked about the acute, where the normal glaucoma that we have around here is the open angle glaucoma. It doesn't normally come with pain and those things. So it's just eye drop that you have to drop for some twice a day, for some once at night. And I don't think it's a bit headache compared to you living your life without vision.
Which one comes with pain?
The acute one, when the angle is really closed, that one need emergency service.
Oh.
That one, the signs are there, the eye become red, vomiting, abdominal pain. If the patient is not seen within a very short time, the eye can go off. But normally, those ones are a bit rare. It's not so common like the open angle that we have around here.
So aside, let's say, you do your regular checkups for glaucoma, and luckily it is detected quite early, and then what would be some of the things, lifestyle that you would have? Is there anything like that? Certain things that you would have to avoid after being diagnosed of glaucoma?
Yes, as much as possible, you've been diagnosed of glaucoma. As I said, the eye is also part of the body. So eat very healthy food.
Okay.
Exercise, get enough rest. All those things, your total well-being also have effect on the eye. So if you are hypertensive, make sure you are taking your medications. If you are diabetic, you are making sure that the sugar levels are controlled, because all those things have secondary effect on the glaucoma. Because some of the glaucoma cases, they are the primary effects. But there are other diseases that other effects will introduce glaucoma into the system. So when those things are well controlled, you'll be fine.
One of the risk factors that I remember our doctor from last week mentioned was race.
Yeah.
And I was wondering, what has race got to do with this? Because it looks like with Africans, it's more predominant.
The open angle glaucoma is more predominant among the Africans. Among the black race.
Okay, okay.
And the acute ones are more predominant among the other race.
Does environment play a role in any way? How is that even possible?
No, you see, there are certain diseases that are peculiar to particular races.
Wow.
And I keep on saying that maybe God knows that we are not economically too sound. That's why I give it a slow one. And the acute ones normally goes to the, the developed countries. But we also have to take advantage of the fact that it's slow. So let's get regular. Because you can't just get up and say you have glaucoma or you don't have glaucoma. Till you are examined and all the necessary tests are done before a person can be diagnosed. You can't just look at somebody's face and say you have glaucoma. So you have to be screened. And then we want to encourage the populace that anytime you visit the eye hospital, ask about your blood, your intraocular pressure. And if possible, document it yourself.
Can you please repeat the word?
Intraocular pressure or IOP.
Okay.
When the doctor do it, just take your phone, document the dates, the time.
Okay.
The next time you also go, at least so you also follow, because it's you, it's about you. So you have to take our health into our own hands so that when there's any variation, you yourself, you know, nobody will tell us, the last time I went, it was 15. How come today is 20? Then you can start asking questions. What is going on? Then together you see how best we can help.
What are the specific stages of the testing?
Normally, when you visit the hospital, the first thing you want to look at your biodata and take your history. As I said the last week, the family history is very, very, very important. Because we realize that it's a bit genetic. It runs through families. So, and we must start paying attention and interest in our families, about what is going on in our family, especially for us in Africa here. We keep a lot of things so secretive. Like somebody is sick, he has this disease, he doesn't want anybody to know about it. And I don't think it's very helpful. Even as parents, a parent is taking medication and he doesn't want the wife or the children to know that this is the kind of medication I'm taking for this disease. Because if the awareness is there, you know your father has diabetic or hypertensive, it helps you to know the kind of lifestyle and those things. But we keep a lot of things so secret. So people come and you ask them about these things, they're like, no, there's nobody, as if you're in the hospital sharing glaucoma.
Because I don't think I'm aware of any family member who has glaucoma, but there's a high possibility that somebody in my family does or did have glaucoma.
At least the immediate family.
At least the immediate family, I don't think. But what of external? So it wouldn't matter. The distance of the relation.
The distance doesn't matter. At times you see somebody come, my father doesn't have one, my mother doesn't, my siblings, but my grandmother or my grandfather has one, or my uncles. And you check and the signs are so clear in the eyes that there's something going on. Or some of them, they are not even aware because they've not checked.
Yes.
So normally when we see this thing, please bring your immediate family. Let's check everybody. It doesn't mean that the fact that somebody in the family has one, all of you will have one. I keep on saying, when you come and check and you don't have it, you don't lose anything.
I think the anxiety that also comes with it, after maybe the possibility of you finding out that you could possibly go completely blind, it also plays a role.
But which one is better? For you to know and start making provision to address the challenge so that you won't go blind. And you decide to be ignorant about it and then going blind.
Right.
So you must be bold enough. After all, when they tell you have glaucoma, that's not the end of the world.
Right.
It can be helped. So far as you follow the procedure, the things that your doctor wants you to do, you're taking your medication as and when, you are doing your checkups, your appointments, you are following your appointments. And other thing to that I want to encourage is the use of eye preparations. We hear a lot of stories about people coming to the hospital. I have this friend, he had this eye, the eyes were red, he went to the hospital, was given this medication. So I'm having this issue, so he also recommended it for me. And for the next 6 months, he's on that medication. And they come and you realize people are on steroids for 6 months and the pressure is at the roof.
Wow.
And especially also for the ladies. We want you to be very beautiful for us, but not at the risk of your vision.
Right.
People want to wear cosmetic contact lenses.
Yes.
And they don't go to professionals. They use super glue to glue contact lens on their eyes, and it's not very helpful.
Really?
It's not very helpful. We want to encourage you. If you have issue, you are getting married, visit any of the eye clinics. Come to INSI, ANC More. We'll fix your contact lens for you. After the wedding, we'll even remove it for you, and you'll be okay. But don't use super glue and other chemicals on your eyes. It's not right.
That even on its own is something that I've been quite scared of. So I've never even done it before. I'm scared, like putting something like on my eye like that. So doctor, we were talking about the test. So run us through it briefly and then.
So we take your history and we want to look at your vision, how far you can see, because then we document all those things. And then for a thorough glaucoma checkup, we want to look at the intraocular pressure. At times, we want to look at the angle where the drainage takes place. We want to look at visual field test. We want to look at the scan. All those things will help us to come to a firm decision as to whether a person has glaucoma or not. But some is so obvious. You check and the pressure is so high, you look into the eye, it's so obvious that this is glaucoma. Others, it's not too clear, so you want to run all the necessary tests to help you to come to a firm decision about the glaucoma.
So somebody is actually interested in knowing, you see, we ladies, our makeup, the glue that we use in attaching the false eyelashes and all that.
I won't say that will result in glaucoma in any way, but you also have to be very, very careful when you are doing those things, because we've had a lot of cases where, especially with the makeups, it comes with a lot of people react. They tend to have allergic conditions with their makeups. You examine, you see a lot of black patches in the eye. Some of the makeups are in the eye, and it's not too pleasant. So please, you can do your makeup, but just be very, very careful when you're coming to the eye.
To the eye.
Yeah.
Man, this one there, it looks like Doc is speaking to me, because what he's saying, Doc is looking in my face.
Oh.
Doc, you're looking into my eyes and you were talking to me. It's like, what?
No, people are looking at you. So when they see you, the message will go down very well.
So I'm a clear example of what you're saying, right? Doctor, so before you go, what would be your final submission on glaucoma awareness?
I just want to encourage all of us. Let's have regular checkups. It's very, very, very important. There is no age limit. Yeah. You can just take all your children, give them a Christmas treat, Easter treat, Independence treat, taking you to the eye clinic for them to run a test to see whether everything is fine. And they will thank you later. I've had experience where somebody has come with a friend to the clinic, and the friend was going through the process and doing everything. If somebody died, and I said, fine, why don't you sit down so that since you are here? Oh, I'm so busy. Oh, we are already here, so let's take you through. And lo and behold, there was tumor in the brain. It was projecting in the eye, on the disc. It was pressing on the person. Immediately had to be flown to the US to do brain surgery. So the eye reveals a lot of things. A lot of diseases of the body show up in the eye. So let's make the optometrist, the ophthalmologist, the ophthalmic nurse your friend. Visit us. Let's talk. And also take interest in your own health. Document the things yourself.
Right.
You pay for the service. Let them give you reports. Keep it on your phone. So that anywhere you visit, it helps also the doctor that I've gone through these tests. These are my results. Right. It helps us to know exactly what to narrow on, what to look at, and then we'll be in a very good position to help you.
Dr. N.Omaboe, thank you so much for your time. Thank
You're
you for the
welcome.
insight. Viewers, I hope that you've learned a lot. We gave you a part 2 of Glaucoma Awareness conversation that we started last week. And we hope that all the questions that you sent in have been answered appropriately. Thank you for your questions. Thank you for sending them in. Coming up next, we have entertainment. We have a great conversation coming your way. My guest for Good Living segment has been Dr. N.Omaboe from Ines Eye Vision Care Center. And so, Doc, thank you once more. Have a lovely morning. And viewers, stay tuned right here on Prime Morning. Coming up next, we have Readathon, Guinness World Records. We are staying with this right here in Ghana.